All right, so looking at today's episode on muscle anatomy question, but that is not it's not basically muscle anatomy question. We're just looking at thorax questions for this series. And so I think we're going to be alternating between thorax, upper limb for now, right? Until we've exhausted a whole lot of our question bank series. So let's get right into it. A 62-year-old man with a 40-pack year smoking history presents with harshness, right-sided ptosis, miosis, and anhidrosis of the right face. Chest X-ray shows an apical lung mass. Which of which nerve is most likely affected? Basically, a very nice question. All right, so we have phrenic nerve, vagus nerve, recurrent laryngeal nerve, sympathetic chain, and your long thoracic nerve. It can be phrenic, it can be vagus, right? It can't also be long thoracic nerve. You're looking at a classical syndrome, which have your Horner syndrome, which is presented by your right-sided ptosis that's going to be dripping eyelids, your miosis, which is constriction of the pupils, and anhidrosis of the face, of the right face. You cannot sweat. That's what we are looking at basically. An X-ray now shows an apical lung mass, which nerve is most likely affected. So when you hear your superior sulcus tumor, which is your Pancoast tumor, is a growth at the apex of your lungs, basically, right? Good. Now, this Pancoast tumor, what happens? The answer to this question is between your recurrent laryngeal nerve or your sympathetic chain. But the answer is your sympathetic chain. Now, here's why it's the answer. Your first order neuron is going to travel from your brain down to your brainstem, right? And then it's going to exit at your T1, right? So at your T1, this spring ganglionic fibers is going to enter the white ramus communicant and then try to reach the cervical ganglion, the superior cervical ganglion in the neck. But here's the catch. If they are to reach the neck, they have to climb up the apex of the lungs. And this Pancoast tumor is going to crush these second order neurons. And if this happens, you're going to lose sympathetic drive to the face. And if sympathetic drive to the face is lost, it's going to present with this miosis, anhidrosis, and right-sided ptosis. So yeah, the sympathetic chain is cut off already. So you cannot, there's no supply to the face. Okay. Now, where does your hoarseness of the voice comes into play, which is cracked voice or your voice is not something like that, which is actually your right recurrent laryngeal nerve. Now, the right recurrent laryngeal nerve basically it loops under the subclavian artery, which is just above the apex of the lungs. Now, this Pancoast tumor can grow and then disturb the nerve, right? Because it is looping under the right subclavian artery, which is just above the lungs apex. And so when this happens, you're going to have what we call your hoarseness of the voice. So that's how it is related. So if the question asks what is responsible for hoarseness of the voice, it is your recurrent laryngeal nerve. But the nerve that is most likely affected in this symptom is your sympathetic chain. All right. So yeah, the answer is sympathetic chain. See you in our next question series coming up shortly. Thank you.